Because of the misnomer, many clinicians often fail to act because they were under the impression that it was a menstrual issue or a fertility issue, resulting in over 70% of women being left untreated or undiagnosed. The new name completely removes the word cyst altogether, highlighting instead that the condition was both a hormonal issue as well as being a cardiovascular metabolic disorder. The clinicians are being retrained to understand this is not a situation where you watch and wait. Instead, early intervention now will result in better quality of life for the patient in the long run. To be considered ice cream, the FDA requires at least 10% dairy fat to be added. Anything less isn't actually ice cream, but instead is classified as either a frozen soft serve or a frozen dairy dessert. Real ice cream should always list dairy as the very first ingredient. After that, it should be things like sugar, eggs, and natural flavorings. That's what makes real ice cream good ice cream.
Excessive amounts of blood sugar unfortunately results in hardened blood vessels, which increases your risk of a heart attack. But unfortunately, ultra-processed foods oftentimes contain chemicals such as aspartame and erythritol that actually can both spike your insulin, creating excess body fat, as well as increasing your risk of blood clots. You need to be checking your soft plaque markers. That includes sticky cholesterol, LPA, and to determine how much time do you have to improve your diet as well as your overall health, get a cardiac CT scan, because that's going to tell us when we can estimate when you're going to be at the highest risk for an actual cardiovascular event.
Peptides are utilized by the body to optimize cellular health. We produced a lot of it when we were younger, but as we age, we no longer produce as much, requiring us to supplement with the peptides you've heard about on the market. This announcement is going to result in better access as more compounding pharmacies here within the United States are going to be able to supply patients better safety, better quality products so that patients no longer have to be reduced to buying black market or research grade peptides any longer.